Blog Talk Radio.
Gentlemen, welcome to the realm of the truly bizarre.
A guy in this town has got one 12 inches long. If you like one that size, something must be wrong. That's too much weenie for a bun to take, and you're bound to end up with the belly. Ha!
Hello, Queen!
I'm the cute one.
Yeah. What's getting naked?
My, it's a big one.
What's going on in there?
Let's just say I take up a lot of cyberspace.
Hey, all right, it's another Friday evening in the Wolf Bytes. Tonight's topic is healthcare. Yes, there's a big debate on that, especially with the Affordable Care Act, a.k.a. Obamacare. And we'll be definitely be getting into that. So, I'm hoping that y'all can hear me okay. We're trying an experiment here instead of using my headset. So we'll see if this works or not.
Okay, we're going on basically just healthcare, and if you have any questions, please post them. And we're very welcome to actually take any comments for what we actually say. And it's very well that people know about you had Obamacare and Romneycare, and how them two actually got compared, and how people actually heard about them. A lot of senior citizens and elderly people actually heard more about Romneycare than Obamacare, because they hold a lot of different things, a lot of different events to actually inform people about Romneycare. Because Romneycare actually helped elderly people, not the younger generation, that Obamacare does. And some states, out of the 13 states, out of the 50 states, right? Not 52, 50 states, we actually have 13 states that do not accept Obamacare. So if you live in these 13 states, you are not technically affected by Obamacare. You will cut funds from different hospitals and stuff, where that can create problems in your economy. What Obamacare is supposed to do is supposed to actually send a burst of money for 3 years into your economy, and if your state can stabilize that, it could actually help your economy grow financially.
David, any input on that?
All I can say is that on my part, there's been a lot of problems with Obamacare and a lot of the healthcare system malfunction.
Okay.
And
Go ahead.
Nothing.
First of all, there is no insurance called Obamacare. The Affordable Care Act is the law, and it is like here in Alabama, you have your choice of either Blue Cross Blue Shield or Humana Healthcare.
Where you just used to have Blue Cross Blue Shield and nothing else.
Well, no, Humana's been around for a long time.
Yeah, that's the whole thing. Most people don't have Blue Cross Blue Shield because 97% of the places have it.
But what the ACA does is it subsidizes it, so that, like, I've got Blue Cross Blue Shield, which, as far as I'm concerned, is way better than Humana. For one thing, it was nowhere near as restrictive on my doctor, especially if I'm like traveling or something. Humana is extremely restrictive. But for my Blue Cross Blue Shield, I'm only paying $23 a month. So that's where the Affordable Care Act really comes into play and is extremely helpful. And if I was making less money than I am, then I would very likely not have to pay anything for my health insurance. But the whole point of the Affordable Care Act was so that people who normally would not be able to afford health insurance can get it, because the health insurance rates have gone through the roof ever since Nixon approved of health insurance and made it to where they can have the insurance stuff. And that's just another thing to blame Nixon. Put on an old Chrissy Dick.
The Republican?
Yeah, it was a Republican.
It's not the Republican. Once again.
Yep. If there's a problem with the government, Republican is at the part of it.
Of Alabama.
Federal government.
Well, it's there too, but more in Alabama.
Yeah.
Did you want to know what's on Alabama, Virginia as a Republican? Hey. We do not want to know if we can pray in school or not. Just get over it. It's like they talk about birth control for 6 damn months. Use our money wisely. Stop wasting it babbling about something you have no control over.
Mm-hmm. David?
Well, as of me, I'm going to speak on my behalf. I am unemployed. I have no money. I have no income. Health care for me is beyond nothing. I've tried many a time to get health care through Obamacare, and I have been turned down, and I have nothing. I am absolutely flat. If I have a problem, it's my problem. I gotta pay for it myself.
Well, here's the whole thing. The people that are unemployed, you don't actually pay a fee. It says if you work and you do not have health insurance, you will be charged a federal fee of 1% the first year. Then it moves to 1.5, then 2, to 2.5, to 3, and it keeps going as it goes. You do not go to jail if everyone makes up that mix. You don't have health insurance, you're going to jail.
No, you just get fined on your tax returns, and if you don't file on federal income taxes, they can't fine you.
Yeah, but here's the whole thing. Like me, they're going to fine me because I actually don't have health insurance right now, but the opening date for health insurance is November the 15th if you're actually going to get some. And the point is I have to pay $90 by the end of the year on my federal tax. That's about it for the first year without having none.
You should be able to do that easily since you've been working. So
yeah, I've already covered it.
Yeah.
Right now.
So we will see what we can do, because you should be able to get something, David.
You should be able to get Medicaid.
I've tried. Yeah. I've tried everything.
When you're here next weekend, and we've got the computer to where we can actually get into the healthcare.gov, we'll see what we can do.
Okay.
All right. Have we whipped the ACA horse enough?
What was that?
The Affordable Care Act.
Actually,
have we whipped it enough, or is there still more there?
Kind of bashed on people's point of view, where you have all these Republicans that actually come in and basically say, "Oh, this is the problem. This is the problem." Yes, if your attorney could not actually withstand Obamacare, like actually hold it up for actually 3 years, after 3 years. Then it's understandable why you rejected it. But here's the whole thing. You're cutting federally hospitals. Like the public hospitals, like Huntsville Hospital, is getting cut federal dollars because of the government. But all the hospitals agree. All the doctors in that hospital actually will tell you, we don't need Obamacare and all this. And it's like, the point is, it's supposed to help people in general, all of us, on an equal ground, to where we can all afford things. We should not be rejected out of policy because, we came out with cancer. They drop us our last second. Yeah, we're on our deathbed because we cannot afford it.
No, I wouldn't even be able to get it because of being diabetic.
Yeah. So basically, it's actually a good thing we actually have. But the whole thing is, people actually want to say, I can't afford it. I actually work a part-time job. I can't afford it in my daily living. It's understandable.
Well, that's what the Affordable Care Act was designed for, was for people that work part-time, that couldn't afford it previously.
Yeah, but still people say they can't afford it because, as everyone says, cost of living has went up. But we have not calculated it in a lot of things.
Well, I'm not saying that the ACA is perfect. Yes, it has some problems and needs to be tweaked. And we've known that since day one. And even the president has said from day one that, it needs work, still needs some work, but at least we can get these things in place now and fix them down the road. Yeah.
Well, here's the whole thing. People think, oh, it should be perfect the first time you inject a law into...
Oh, ain't nothing like that.
Nothing is perfect. Nothing. Not even yourself is not perfect.
Well, do you think we have Windows 95, 98, ME, Vista, 7, 8?
Yeah,
nothing is perfect.
Oh, it's the same way when you have Apple products. Everyone wants to blame Steve Jobs for making Apple products. He was a great man. He actually did not want to release them this fast. Technology has advanced, and he actually passed away. Technology has rapidly grown to the point where most people hate Apple products because they're so crappy. Oh, the reason why they're so crappy is because all the CEO who runs it now wants money, nothing else but money.
Mm-hmm.
You don't care for anybody.
Just please, and even the government is saying don't call it Obamacare anymore. It's the Affordable Care Act, or the ACA. Obamacare was something that the Republicans came up with to try and badmouth the ACA. So let's just call it by what it is, the Affordable Care Act.
And everyone, Obama did not shut the government down. The
Republicans did. Anything else on the ACA?
Let me think. We got the Republican side. What about the Democratic side? What do they believe that should be good for our economy-wise? Oh, I actually think about that.
We're not getting into political party debates, though.
Oh, yeah, we kind of are because we're actually talking about a government thing that wasn't a competitive debate for 2 years.
We're talking about We're talking about health care.
Oh, and health care in general, when this issue popped up, is because as soon as he actually died without having health insurance, and he actually thought it was a good thing for people to actually have health insurance. It doesn't matter if you're on your deathbed or not. You should have something to cover you. These hospitals actually charge you out of ass for everything. You go in a hospital, they charge you for the whole damn room.
Caller.
Okay.
Hello, you're live on Bytes. Hello?
Hello, you're on Wolf Bytes.
Hello?
I'm here.
Don't know what happened there. Try calling back when it's actually at the phone. So, but yeah, if you want to call in, chime in on this, 347-945-7065, or you can talk to us in the chat room here on Blog Talk Radio. Let's see, okay, it's about half the show that we've covered on the ACA. What about Social Security?
Long story. Like every program has its flaws and has its greatnesses.
Okay, let's try this again. Yes, caller, you're live on Wolf Bytes. Hello?
Caller?
Apparently their signal is not picking up too well. Or they're actually on, just the whole thing is the phone is not letting them speak too well.
I don't know. But Social Security was designed to be Republicans try and call it an entitlement. I'm sorry, no, that is not a government. You want to talk entitlement? Let's talk about Congress insurance and the vacation days and such. No, Social Security is not an entitlement. That's why we pay into it, so that when we retire, we get that money back. We don't have to. It's not a government handout. So, comments, David.
No comment.
Why?
He's the generation, your generation, that should be all over this topic because you're in danger of not being around when you actually retire.
Yeah, because the Republicans keep pulling money out of it that they shouldn't be touching it and trying to use it on other things.
Oh, the whole thing is with Social Security. It's made to designed to retire. Yes, you have SSI and you have SSID. disability comes from Social Security being paid in so long. But here's the whole thing. People who are disabled, you actually really have to be really disabled to actually get that check. And most people who are actually really disabled and doctor approved, they still don't get that check. They get more denial letters than the right people. You have some people that actually pretend to be crazy, and they're like, they're not crazy. They are just pretending. And even the doctor will look at them and say, they're pretending, but I'm going to write that crazy as hell because they're acting like it.
We paid into that, but that's supposed to be our retirement. Okay, let's try this again. Tyler, you're live on Bytes. Can you hear me this time? Are you there?
Tyler, Bytes. Are you there? Because we cannot hear you, but we do see you online.
Hello?
256.
No, 254.
254-220-0182.
She might have done that.
Hold up.
I know.
Hold up. 251.
Is that Donovan?
Maybe.
Hold on. I don't know who it is.
I know I shouldn't do that number, but hey.
That is Donovan. That is Donovan trying to call.
Huh. Donovan, are you there?
254.
Yeah.
442 254-220-0182. Is that the number?
No. No, stop telling people, reading people's phone numbers on the air.
Oh, dang it.
I just didn't think anyone wanted to listen to me do dishes while I was trying to listen to the radio.
I'm sorry, Don.
All right, you there now, Donovan?
I'm here.
Okay. We've been trying to engage you, and all I could hear was you doing dishes.
Yeah, I just didn't think anyone wanted to hear me doing dishes while everything else was going on.
Okay.
Tends to interrupt.
You got
Tends
something
to interrupt.
put in on the topic?
Huh?
You got something to put in on this topic?
I got 5 years worth of something to say on this topic.
Okay, on the Social Security or on the ACA? Or healthcare in general?
On healthcare in general. Hell, I didn't have insurance when I fell down a flight of stairs 5 years ago and I lost damn near a decade's worth of memory.
Yeah.
I spent less than 45 minutes in the ER. They sat there and they kicked me out. After 45 minutes, gave me a CT. I had no idea where I was going to go, or how to get there. Hell, last thing I remember, I was in California, and then I wake up in fucking Utah in the bottom of a flight of stairs. And they just kicked me right out the fucking door. Thank you very much, Obama. Thank you, Obama. Kiss my ass. Have a nice day. And it's taken me 5 years since. It was actually 5 years earlier this month. I believe it was on the 23rd. It's been 5 years ago that I fell down those steps, and I'm just now getting the help that I need.
Okay.
But I'd be saying
all because I couldn't get any help because of the new Obamacare laws. Oh yeah, before the laws I was able to get this and I was able to get that. But hell, even 5 years ago they were starting to make changes in anticipation of Obamacare.
Okay.
I got screwed by every one of them.
It's different for everybody. Yeah, it looks like it hurt you, but it's definitely been a godsend for me. Without it, I would not have insurance. I would not be able to be on the medication and stuff that I'm on now for my diabetes and everything. So. Thanks to the ACA, insurance, that my medicines only cost me $5 each.
Yeah, but it's people like me that pay the price for all that. They get to pick and choose who gets what.
All of us that pays. Everybody that pays taxes pays the price, pays for it.
Yeah.
The whole point of it was so that everybody can have insurance.
Yeah. Sure. How are some of the people that can't afford it? I mean, like myself, get health coverage.
Well, part of the reason why the states are supposed to expand Medicaid. And like here in Alabama, Medicaid is only for women and children. That's it.
Here's the whole thing. Medicaid.
That's true.
All kids. It actually was crazy when Obamacare was actually released. You have all kids and Medicare now.
All kids has been around longer than Obama.
Okay, all kids have been around. So his Medicare in Alabama actually went down, and all kids actually have went up. All because the government did not accept it. It actually hurt the program, and the other programs have not hurt as much. And there's no restriction on Medicaid now in Alabama, still in all kids. That sounds very interesting.
The only thing I could say is that they want us that cannot afford it to pay a premium. Well, I'll pay the premium if it can be low enough where I can put in a few bucks and get health care. But unfortunately, I do not have any money, and I can't expect to pay anything until further notice. And I can't get health care.
Yes, I'd be able to. I'd gladly pay the premium on a healthcare plan for what I needed. Unfortunately, because of the conditions that I've got, and first of all, I don't have any diagnosed conditions, or didn't when I started this process, so I didn't qualify for any kind of county help or state help or federal help with those conditions. But by the same token, because I suspected that I had those conditions, I was told that I had to pay the premium on the insurance in order to get anything diagnosed, as though I already had them. So I had to go up to like a silver or platinum or something like that in order to get any kind of help. And even then, I had to pay like $3,500 a year up front before I could even get insured. And even then, my medications would have been higher than I could afford. The premiums that I would have to pay at least like $50 per doctor's visit, which I don't have, and I don't have coming in. You know, I work on donation right now.
Yeah.
You know, and I don't get in enough to cover everything.
Yeah, something's not sounding right there, because that's definitely not the way it should be working. Because when most people were afraid of Obama, health care in general was because we're actually going to turn our health care into Canada's health care. And a lot of people tell you Canadian health care is the worst. Not according to Canadians. Yeah, still according to some Canadians. You're listening to the Republican Party that's trying to say that it's worse. I listened to a university teacher who said it was worse. That's from his point of view. But I don't know. I don't live there. I would gladly pay slightly higher taxes to have free universal health care. Like almost every major country on the planet.
Well, like you have UK where everyone pays the same taxes, you pay everything the same.
Right.
So that is a good idea, but some people can't afford the same thing. That's the only problem with it.
Well, they actually did that back at the beginning of World War II, I think it was.
Yeah, after Germany.
And, yeah, I think the U.S. should have done the same thing at the same time and not let Chicky allow the health insurance companies to railroad and dictate costs and stuff.
Oh, we have a whole bunch of corporations that do a lot of crappy things to people and pay people crappily. As I believe that I will support small business any day of the week for a corporation.
Mm-hmm.
Don't matter if they actually don't use the money for the right thing.
Yeah. They pay a little bit more, but better off.
Yeah.
Especially when it comes to giving money to Walmart.
Yeah, the hellhole. We're going to have a 10th one in Alabama, North Alabama. Thank you.
All right, about 3 minutes left.
Some Republicans that we have are in here. I said, hey, hurry up, please. That's a Republican store. Why not? I don't know. It's just red as hell.
Next show will be right up several people's alley. Next Friday, our topic will be addictions, habits, and attachments.
Lovely.
Yes.
Yeah, wonderful. I mean, there'll be a lot of talking about that. Trust me.
Yeah. So
now there'll be a lot of talking.
I thought I'd be bringing up the one addiction that is not very much talked about, and there is no 12-step that program for it or anything. And that's the addiction to approval.
Wow. Wow. Really?
Which I have missed every Wednesday so far, and I have been hoping to actually catch it next time it comes around.
Then there's always David's addiction. And don't try and deny that you aren't addicted to Facebook.
Yeah, I'm just not addicted to Facebook alone.
Well, the whole thing is, everyone has an addiction. Everyone has a cane. What is yours?
Crutch, yeah.
Yeah, crutch, the cane. It's still the same, almost. Almost.
Same thing, only different.
Yep.
To quote the audience participation from up north.
Ta-da!
Anyways. Yeah. You got to go. And I've advertised today December 12th show will be our first Q&A. There's another podcaster called it Q and Slay, where I'm asking you listeners to submit your questions for us. And we will have to answer those questions. Just be sure to send in your questions. So which one of us are asking that question to? And also, we will have to answer that question. Send the questions to work.bytes, B-Y-T-E-S, 2014 at gmail.com with the subject line Q&A, and we will be compiling and collecting the questions between now and then, and if we have enough, we may actually go over into a second or even third show, maybe do a quarterly Q&A, quarterly anyway. Listen, it should prove to be very fun. So, thank you for calling in, Donovan, and your input, and we look forward to hearing everybody and talking to everybody next Friday. So,
either comment, questions about anything we said.
Yes.
Don't worry, I'll be calling next week.
Be sure to give us your comments. Bye.
Bye.
Bye.